ரொம்ப இது இல்லாமல் பார்த்துக்கிட்டுங்க. ஏன்னா நின்றுடக்கூடாது, இந்த இது கட்டாக இருக்கக்கூடாது. போதும் போதும். Dear friends, glad to meet you on this day, Saturday, 18th February 2023. We are happy to inform you that we have successfully finished today our 1062nd case of Puberphonia. So we are successfully continuing it, and we are aiming to teach our method to all the ENT surgeons who are willing to undertake a small lesson from us. So we want to give this as a course, because partially and initially the treatment is done by ENT surgeon, and it should be followed by trained people who are able to manipulate the uvula, our own method, and what they have to do to manipulate the uvula. So this course is very important. So if you want to have a dramatic change to improve your voice and boost your confidence around other people, that course is for doctors to initiate a treatment for puberphonia. The patient develop puberphonia, boys develop more confident, deeper and more powerful voice, so they can stand out in the crowd, and they will be courageous to express their views. It is only by simple exercise and lifestyle changes So if somebody is not making a public presentation, public speaking, we will try to give a powerful and authentic voice in 5 days. So they will have their own recorded voice and feedback. That will be very, very essential for them to follow. What more they want, that's all. So this is a powerful tool by all ENT doctors can practice. Especially Malaysian doctors are requesting me to give a training for them. But they should be able to understand, they should be able to devote more time with the patient. Morning, we are able to devote the time morning 11 o'clock to evening 7 o'clock. Continuously, we are sitting in the clinic. My colleagues, when I started my practice is from, after retirement from government service, it is from 10 o'clock to evening 6 o'clock, continuous. So God had created the idea just like going to the office, morning going to the office and evening leaving the office hours by 6 p.m. There is no question of midday break at all, or break midday nap. So for this training, there is no question of more experience in speech training. all doctors and paramedical people can understand the training, but doctors are very much needed. ENT surgeon, what I am telling is they have to do uvula manipulation. That is one can be done only by ENT doctors. So that is the main thing. So ENT doctors first they have to do it, and sorry to tell you that you cannot learn it all in online, because what you are saying, see, we cannot explain it in online. You have to see and do with your own experience. And any amount of video seeing won't give you an opportunity to um, for complete learning. So it needs a practical workshop, and learning also by books. I don't think you'll be able to do it or train it, because what I am able to do, you should be able to understand and do it. So a deep knowledge should be created to have a good understanding of how we treat puberphonia. So this is a manipulation by ENT doctor, and the other thing is only simple exercise. So the training period is at least then doctor need only 1 day, but the paramedical people should understand it. So at least 5 days training they have to undergo under me. So that is very much essential. Then only really they will understand what they have to do it. Because in our hand, my personal, I sincerely telling, there is no failure at all. If they are not interested, so failure can occur. But treatment always will have success, because everyone knows, all ENT surgeon knows, there is no structural changes in the vocal cord. There's no structural changes in the larynx or respiratory tract to cause for puberphonia. This is only non-breaking of the voice. That's all. So the treatment is very simple. If you are able to get the voice, then you can maintain it. Our books repeatedly says puberphonia boys, they are high pitch. They will have low pitch when they cough, when they strain, when they shout, when they snore. So we are just maintaining it. That's all. These patients won't have any vocal nodule, polyp, or cyst. They may have all problem of hoarseness, breathiness, vocal fatigue, loss of voice range, voice break, raspy voice, scratchy voice, voice with coughing, and they will have even neck pain. So you can attribute, see, many of the puberphonia voice, they have done many tests. In our feeling, definitely general health should be checked, but nothing more to examine except a stroboscopic examination of the vocal range. So how we can treat it? It is a very simple procedure for puberphonia treatment. And many people are telling how um, vocal cord should be maintained, how much energy we should give to the vocal cord to strain all these things, because we are not concerned about the vocal cord at all. It is normal. But here we want to tell the training doctor the problem is not in the vocal cord, the problem is in the region of the uvula and resonance. There is no nodule, polyp, or cyst. They may have lot of variation in vocal cord movement, little paresis, little keyhole, bowing of the vocal cord, anterior placed arytenoid. So these things can happen, but it doesn't cause a problem of voice problem. We can rectify that without doing any correction in the vocal cord. So the puberphonia treatment, our treatment is a new concept of puberphonia treatment. We have found out it is not research at all. It is not research. It is our own invention. We treat puberphonia boys who want to make a difference in the voice and also life. Our training technique used to change the high pitch of the voice into low pitch, thereby transforming their life. Our mission is to help and find their own true voice. That is why most of the boys get their ancestor voice. We are not creating a new voice for them. They are having their voice which is not matured at the age of 14 or 16. So that is our treatment. So there are two parts in the treatment. One is by ENT surgeon. That is only one day for some 10 to 15 minutes. And 5 days continuous training by the people who are experienced in uvula manipulation. That we have put a booklet also we'll able to give. It is available in the internet also. So what ENT surgeon do? Essentially the total treatment is only for 5 days. 6 steps are involved. Number one, as soon as the patient arrives, you find out what is the pitch of the patient. You need not do any hormone tests, any assessment for their family or mutated change. All these things, their anxiety, IQ, nothing need to do it. While talking to the boys, we know whether he is puberphonia or not. So we have to first day itself voice pitch analyzer. How much is their pitch? Whether it is high or low. And have a clear general checkup. How is their health? Any other neurological problem, any other seizure, all these general things we have to do it. because this is nothing to do with puberphonia, but they can have associated problems. Associated problem cases, or we are not taking it, we have to reject it. Then, as a routine examination, you have to do a endoscopic examination of the larynx, vocal tract. 100% the vocal tract will be normal. So, number one is voice assessment. Second thing is in the minor theater, you have to assess the vocal cord by doing stroboscopy by an endoscopic procedure with a little minor local spray anesthesia of the throat. The third thing the surgeon has to do is uvula strengthening by placing a thread in the uvula. How we can strengthen the uvula? The strength of the organ can be increased by increasing the weight and vibration. This is Newton's law. Any organ, if you want to increase the strength, you increase the weight and vibration. That is what we are doing. We are doing it with many other method we have tried for the last 30 years. Our simple procedure is place a thread in the base of the uvula. So, under anesthesia, without any problem, we can place a thread. That is, we place a knot in such a way that can be removed on the third day easily. Have it in mind. Don't tie it so close to the uvula. Don't strangulate the throat. Just place it and you put a thread 3 inches away. So the patient on the third day, the patient will cough and bring the thread in the tongue. Just if you just cut one leg of the thread will come easily. That's all. Then the fourth step in the treatment of procedure is the doctor, after placing the thread in the uvula, he has to give a sinus resonance. That is our special technique. How will you give a sinus resonance? That time itself, they will have a break of voice because already we have strengthened. Now we are going to give only a exercise which resonate in the nose. This is our own innovation. That's all. We'll be able to tell how you are able to do it. See, in our book, our ENT book or resonance book or any audiology book, there are 3 types of resonance only they suggest, or 1 or 2 or 3. Or 1 means resonance created at the level of the voice box. That is the where the vocal cord is situated. Or 2 means mouth, where the tongue moves. Okay, so from the tip of the tongue to the pillars of the tonsil. So oral cavity, that 2 posterior portion only above the tongue. The second place of resonance. The third place of resonance, they say, from the tip of the tongue to the lips. That means that underneath the tongue also. So the 3 places only they say the resonance as resonance 1, 2, 3. What happened to the resonance in the pharynx? What happened to the resonance in the nose? What happened in the resonance in the sinuses? This is almost completely not taken seriously. That's what I can say. Probably newer books will be able to tell. But we are more concentrating on pharynx, the important place of resonance, and the sinus. Mouth, definitely a cul-de-sac formation is there and good resonance is there. How the resonance comes, a re-vibration, that's called resonance, that's all. The air coming from the chest is minimal only, but the folds by which we talk, more air is coming from the nose. So that is what we are experiencing. That means that simply we can say and demonstrate this procedure. See, Venturi effect is playing very well. I was demonstrating one ENT doctor asked about Venturi effect. They are not, they are very intelligent, but they are not able to tell what is meant by Venturi effect. Demonstrate Venturi effect. So, see, um, we can demonstrate Venturi effect very simply. Okay? Um, why, while cooking, our mothers used to increase the fire by blowing air. The blowing air is coming from the mouth to the tube funnel. Okay. The air will be more or less when you blow by your mouth close to the funnel. Or take the mouth a little back and flow. Which category will give more air of blowing? That's all. That is called Venturi effect. Close the mouth. Yes, funnel is placed close to the mouth. Funnel is placed little outside the funnel, 3 inches. The resulting air, you will get more air while blowing the mouth close to the funnel or away. Anybody can practice. If you blow keeping your mouth lip close to the funnel, the air is less. But if you bring back your mouth little away from the funnel and blow, the air will be more. How it happened? That is called Venturi effect. While blowing, the air from the mouth comes and it takes the air from side also. And all the air goes to the funnel. This is what happening in the pharynx. A Venturi effect is formed. So more air is coming. So this is only because of the direction of the uvula. And uvula also split the air right and left. And when there is a cul-de-sac formation, a deep circle, a, uh, the world is formed, Shulan is formed. So that create more air, more pressure. The same thing happen in the nose also in the treatment of puberphonia. When air is pushed into the nose, air comes to the nose. If it is passes without resistance means it is just a Royapettah. But in our treatment, what happens is there is a Bernoulli's phenomenon happen here. The air tries to enter into the sinuses. There it forms a effect. So that effect resonate or re-vibrate in the sinus and give what is happening actually in resonating in conch blowing, chunk flowing. So that is why I am going on repeating the physiological process of treating puberphonia. We are using conch or chunk blowing for the treatment of puberphonia. So this we have to understand so that the treating doctor first he should achieve in creating a high pitch voice to low pitch by uvula manipulation and sinus resonance. This is called mute effect. Mute effect in the nose and sinuses. Ordinary air passes the nose, that is Royapettah, the voice is not strong, sound is not. But if it is enter into the sinus and resonate, reverberate, the voice will be more strong and it is low pitch. That we are going on repeating in our article and repeatedly in our books, that they fail to understand or fail to read more and think more. They say that it is not clearly told, and I think it is our duty to tell the people how we treat. So special technique is definitely there. It is not research, it is our own invention. We'll repeatedly will tell. Because every day, every weekly 2 or 3 cases we are getting. And the 3 people, I am sorry to tell, most of the boy, they come all alone without informing the parents. Why they are coming without informing the parents means, number one, parents ask doctors and many educated people, they only counsel. Counsel means they will tell you will be all right with this puberphonia voice. You can become rich, you can become more educated, you can become more productive people. That is not wanted. Counseling is not at all wanted by the puberphonia boys. They want treatment because when they call, other people will feel them as a lady voice. They want correction for that voice only. They never want counseling. They never want method how to become a rich, how to become more authentic, all the things they never want. They want to have a correction in their voice, thereby their deep rooted depression, as somebody recognizing their voice as a female, they want it. That is this by the treating ENT doctor will get it if we really understand the pharyngeal resonance by manipulation of the uvula and sinus resonance. If they really understand and do it, they'll be able to succeed in treating a case of puberphonia. So the puberphonia voice, the ENT doctors can create on the first instance, and the patient will be happy, and the doctors also will be happy, and the relative also will be happy. So that finishes the treatment, but that is not the last, because once again the same puberphonia voice can come. That needs 5 days regular training by trained people who are interested how to achieve the uvula manipulation, how to achieve a pharyngeal and sinus resonance. That needs lot of training for a paramedical people who is able to devote more time in resonating the sound and giving the confidence to the voice. That will, so many questions they will ask whether this will be a permanent or not. Or so next Saturday I will be able to tell what more I can do for the training for the thing. The question is, many people used to ask whether it is a permanent treatment or not. Yes, definitely our treatment is permanent, permanent, permanent. Why it is permanent? I will be able to explain why it is permanent. I will be able to explain very well it is permanent. Everybody knows, but still people are thinking that it need not be permanent at all. No, 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 no. It is a permanent treatment for puberphonia in 5 days itself. That important thing I will tell you on next Saturday, that is 25th by 5 p.m. Hope to meet you on next Saturday. So thank you very much. Great hope we'll be able to give a small explanation and definition for how to treat the puberphonia. Thank you very much. Great.